Welcome to The Other Side, Mississippi Today's political podcast. The Other Side lets you hear directly from the most connected players and observers across the spectrum of politics in Mississippi. From breaking news to political strategy to interviews with candidates and elected officials, we'll bring you facts, perspectives, and context that helps you cut through the noise and understand all sides of the story.
I'm Bobby Harrison, political reporter of Mississippi Today. I'm here with my colleague today, Geoff Pender. Geoff, how you doing?
Hey, Bobby.
Geoff, today, as you know, we have as our guest Commissioner Mike Chaney. Commissioner, how you doing?
I'm doing very well for a Friday morning. And you two guys look like y'all are doing well, too.
Good morning.
We're going to make it. I mean, for people who don't know, Commissioner Chaney is a state insurance commissioner. Commissioner, you're in your fourth term?
Fifth term.
Time flies. And I guess it shows we're getting old because I covered you when you were in the state house.
Same here.
And then in the state senate. And now you're a veteran commissioner. So,
well, you know, this is my fourth career. I never intended to stay in politics more than 8 years. Dadgummit, I've been in here over 30 years.
Yeah.
So you never know what's going to happen in life.
Yeah, you've seen a lot as a member of the legislature and now as insurance commissioner. We're here today to talk about, we may talk about several things, but the primary thing we're going to talk about is legislation that passed during the 2024 session. We were spending a lot of time talking about Medicaid expansion, but another significant piece of legislation passed that creates a state marketplace where people would go to purchase insurance instead of doing it on the nationwide insurance marketplace. And Commissioner, I guess it says something about us getting old, because I remember you touting this back in, about 2011, 2012, supporting that.
2011 and 2012, when the Obama administration, well, I shouldn't say the Obama administration, but when the Affordable Care Act was passed in 2010, it actually was a plan that was early on adopted by the Republicans back in 2004, the Republican Governors Association. So it was something I was familiar with. Haley Barber had asked me to look at it in 2005 when I was in the legislature in the Senate because I happened to be vice chair of education at that time in his life. I later became chair of education, but insurance was a big portion of some of the benefits we gave to teachers, and we were looking at basically what we call portability. And we didn't have that and still don't have portability today. We should have it, but we don't. So it was something that was not new to us or the Republicans. It had been around for a long time. And I bought into it very early. I was skeptical at first, but the more I dug into it, it looked like a program that would work to provide health care for the state of Mississippi at an affordable price for our citizens. That was the goal. That's what we were trying to do. If you don't have a healthy population, Bobby and Geoff, you don't have a population that can enter the workforce and be productive. So education, law enforcement, healthcare all go together to have a healthy population and a healthy economy.
And tell us, I mean, as part of the Affordable Care Act, some people call it Obamacare, we talk about Medicaid expansion, but another important part was this marketplace that was set up where people could go and purchase insurance, and if you're in a certain income category, you get federal financial help with that insurance.
That you do. Let me digress a minute and say that in 2010, after the law was passed, it was called the Patient Protection Affordable Care Act, PPACA. We explored a lot of the options. We looked at a state-based operation, which Governor Barber had encouraged us to look at. In 2012, and 11, actually, we applied and talked to the federal government about operating our own exchange. We also
Which the Affordable Care Act allows.
Care Act, before it was being set up.
Yeah, but it allows the state to do its own exchange or be part of the nationwide exchange.
We'll get into the parts. Okay. Well, I can do it now, but you have three ways to operate exchange. You can operate an exchange on the federal platform, which we call the FF, Federal Facilitated Marketplace. You can operate it on a bifurcated plan where you use the federal platform, but it's operated by the states, and some states have chosen to do that. I think 19 are doing it now. And then you have a strictly state-based exchange, which several states are moving to. And actually, the Republican Governors Association is now adopted and will probably suggest to the Republican governors that have not expanded over into a state-based exchange to convert over to a state-based exchange. So you got three ways: state-based exchange, using the state-based format, and that's basically the federal format that's operated by you. Then you can use a bifurcated system with the federal government being your backstop, and the state operates it under the federal software. It's basically a software program. And then you can operate just as a federal exchange. So there's cost differentials and all of that, and that just means that when we applied for it back in 2011, we were the last state to be denied the ability to operate a state-based exchange simply because the new governor at that time, Governor Phil Bryant, would not sign a letter of intent to let the state operate the exchange. Although Governor Barber had signed a letter, the federal government wanted one from Governor Bryant, and he was raising, if you remember, a lot of concerns about he didn't want to endorse Obamacare. But
I remember you might have been a little perturbed with him.
Well,
at
Geoff,
the time,
if I recall, I said something one time and you put it in print. I don't think he's been a friend of mine since then. But Phil's got a good heart. He just was operating on the populist side, which is
there were a lot of unknowns.
A lot of unknowns then, and so now we have more knowns, and I don't know how much the political areas have changed. I don't look at it strictly on politics. I look at it as being pragmatic about how do you address the issues of health care for the citizens of the state and what's the best way to do it, and at the same time not undercut the providers that have to provide health care, especially within the Delta in the state. And to do that, the best approach is, in my opinion, is to have the private marketplace provide insurance, and that the private marketplace in this case would include the Affordable Care Act operated by the states.
So if everything, the legislature, it was rejected in 2012 because of the governor, and we've been into federal exchange ever since then, and it's been successful for Mississippi, I would argue, and I think we have about 250,000 people signed up.
We got a little over 250,000 signed up at the present time, Bobby. If you recall, prior to the beginning of January 2024, we only had about 160,000 people that had signed up. And our numbers that we quote are sometimes different from the federal government's numbers because they look at people that have applied. We look at people that have actually paid the premium or in the process of just enrolling and maybe haven't paid the premium. So our numbers are what we call live numbers, and they will move and shift a great deal at any given moment. So when we talk, and on this podcast, I would just say the numbers we talk about are kind of rounded. We're not going to be real specific.
Uh-huh.
And when you look at the numbers and the number of people that have enrolled, we've got about 155,000 new enrollees in 2024. But at the time that we began this in February, we had 140,000 in round numbers of new enrollees. And out of those numbers, the total numbers that were in the exchange at this point, we know how many were at 150% of the poverty level, which is about 95% of them, and how many of them were between 100 and 138%. We really had to do a lot of work because you had to break down where the other 12% are, and a lot of that depends upon income. So that all played into Medicaid expansion. We'll talk about that later, but the bottom line is that the people that came over, about half of them came out of the disenrollment out of Medicaid that was required with the, expiration of the waivers to put people on Medicaid by the Biden administration.
During the pandemic.
Yeah. So what these people had to do was find insurance. And we had kind of worked with the Department of Medicaid, and it's tricky to do this politically, and said, look, if people are coming off of Medicaid and the family can qualify, put them on the ACA. Suggest to them, you can't enroll them, but we can. Suggest to them that they look at us, and then we got about the other half of that 140,000 new enrollees came from people just strictly saying, this is where I need to be. They got a job. They're all working. The premiums are very low, although the out-of-pocket costs are high. We've got some other things that we've done to reduce that, and that's called cost share reductions. So people up to 138% of the poverty level could get insurance for $29 a month. In round numbers.
Because, and that's a key point that I wanted to get into. Well, first of all, will the state exchange be? It won't be a bifurcated. It won't be. I mean, it would be a strict state exchange, or is that known yet?
If we develop a state-based exchange, we've still got a couple of steps we've got to do. We've got legislative authority, that's number one, and
then that happened during the 2024
that happened
session.
2024 session. And to our surprise, I didn't think that we would get there, simply because some of the leadership had told me they were violently opposed. And to my surprise, Representative Trey Lamar called the deputy commissioner over and said, "I want to talk to you." And it was like 10:30 in the morning. We sat down, and I had been running some numbers to look at the possibility of where we would be on Medicaid expansion. So I had that sheet with me. I had met with a group of people privately about where we were on the exchange. So Trey said, we're going to pass 2 bills today. I said, "Oh, really? Do they affect us?" And he said, "They both do. One of them's going to be Medicaid expansion on the House side, and the other one's going to be exchanges." And I said, "Can we look at that?" And he said, "Yeah, better look quick. We're going to pass them at 3 o'clock in the afternoon." That's why they got passed. So.
Well, Commissioner, can you explain, what's the difference between a state-run exchange and a federal? Why might there be some cost savings? Or
So the difference between a federal exchange and a state-based exchange, or the way they operate, is just in the percent of dollars that the state base would keep from the carriers. It's kind of a smoke and mirrors game, but the federal government gives the carrier, or the people that sell on the exchange, we have 5 at the present time, a rebate for user fees. It's 3.5%. And the companies give back, they charge part of that as a premium, they give back a portion of that to the federal government. And today, the federal government gets back the 3.5%. In some states, they keep part of it. Georgia, under their new exchange law that they're expanding to, would keep 2.5%. And that comes back from the carriers. They have to pay that to the state. The federal government has now dropped the percentage in the last 6 months to 1.75. That's what they're charging most other states. And those states are now complaining about what Georgia's doing, saying, y'all are messing over. We said, and I would say the same thing to those states like New Jersey that Georgia did. Look, you had your opportunity. Y'all have gotten a lot of money out of this, and the southern states or the red states have not taken that money up. If you're going to get your share, they ought to get their share too. So we have the option to say 1.75 or 2.5%. We have chosen to say in the legislation, and we'll go back to this in a second, that we would charge up to 3.5%. Anything above that would require legislative authority. Our goal is to charge 2.5%. That would bring in about $35 to $50 million a year in income on the state exchange. So what's the difference between the state exchange and the federal exchange is this, that the state exchange can offer more products. They can buy reinsurance to lower the cost of the premium to the consumer. It won't be a lot, but $20 or $30 is a lot of money to some people in a month. And the other thing that you could do is you can offer some other type of products on the exchange that we normally had offered through what we call the Small Business Health Insurance Option Plan, the SHOPs. And small businesses could go in and buy their groups or do defined contributions to a consumer, and they could buy on the exchange. It gives a lot of flexibility for individuals, small business, and for individuals to buy insurance from at an affordable cost. And you can have small groups in Mississippi are defined at 100, and that was determined early on. It's a suggestion of the companies. They really should be at 50 maybe instead of 100, but it gives a lot of flexibility to the state to provide health insurance. As an example, right now we have municipalities that are subsidizing their employees to go and buy on the exchange. And you said, how can that happen? Well, municipalities are not known for paying their workers a lot of money, and they can qualify. If you got a family of 4, it's a little over $44,000 a year in income. A lot of the municipal employees that work, especially in the street departments and the utility departments, don't make that much money. So they qualify to buy on the exchange at a subsidized premium. And we've encouraged municipality associations to get people enrolled in the ACA. It's cost effective for that city. They ought to do it. And it keeps them from having to raise taxes at that point.
One thing I looked at, this is an old Commonwealth study, I believe, that several years old, but I think it may still hold true, showed that state-run exchanges, by and large, have cheaper premiums than federal or bifurcated.
The Commonwealth study is still valid today. We have cheaper rates. As I just said earlier, it may not be $20 or $30 a month, but if we have enough income in the state-based exchanges to buy large quantities of reinsurance, which moves up and down, we can really make a difference in premium. Early on, what I did back in 2011 and 12 was to adopt what we thought would be qualified health plans, what you needed to have to be qualified to be on the exchange, one, and number two, we determined the essential health benefits. And what was unusual, I was one of the few commissioners that believed that we needed a strong mental health parity law. So that was included in our essential health benefits. And that wasn't something that we sat in a room and three guys put together, or three other folks. We had about 200 people that had input. We had quarterly meetings. Most of this just went kind of under the radar. We had a lot of input from the industry. The unusual thing was that the healthcare providers were not real cooperative on the hospital side, but we got a lot of cooperation from the mental health folks. And so we kind of knew where we were headed. And when we gave those qualified health benefits to the federal government and said, this is what we think we need in Mississippi, they adopted them, and they're basically the same health benefits, what we call essential health benefits, throughout the whole United States. They kind of adopted and we worked very close with the CMS at that time. Didn't talk about it because politically it wasn't a smart thing to do, according to some folks. And we said, look, it is a smart thing to do. You've got to communicate if you're going to govern. If you're going to take care of the population, you've got to communicate with the regulators. And the regulators in this case were the federal government, HHS, and Washington, D.C. That's a long answer to you.
Yeah. Well, you mentioned we've got 5 companies now writing into the
That's
exchange. Correct. I know early on we struggled to get that going, didn't we?
Well, I remember that when Gary Cohen called me and said, Commissioner, he was head of SOCIO and CMS at the time, we're not going to let y'all have a state-based exchange. I said, Gary, you can't do that. And he said, well, I'm sorry, but CMS is determined, and that was Kathleen Sebelius at the time, and she used to be the commissioner in Kansas. And I had former commissioner call her. I couldn't get her on the phone, but she had to answer his call. And she said, I can't do it because the governors normally have to have a letter, and your governor's been so vocal, and that was Governor Bryan at the time, that we just don't want a chance of him just suing us and everything. We're just not going to let you operate a state-based exchange. It was just that simple. So I said, Gary, we got to recruit somebody. So we had 38 counties covered.
Right.
Out of 82.
Yes.
So I think I may be off one or two counties.
I recall that.
And I got a call from Humana. I think their director at the time was a girl named Heidi Margulis. And Heidi called and said, Commissioner, we got good news and bad news. And I said, well, give me the bad news first. And she said, we can't cover the 38 counties that are presently covered in your state, but the good news is we're going to cover all the other counties that are not covered. So you'll have 100% coverage. And I said, if I could crawl through this phone and hug you, kiss you, I would, because that was great news. And we got coverage on 82 counties. People came and went and out of the exchange over the next few years. Humana no longer markets in Mississippi on the exchange. They pulled out. They are still heavy in Kentucky. Kentucky at that time had a commissioner that believed in a state-based exchange and a governor also, and they developed their state-based exchange. And we helped them. And our studies were given to New Mexico, Idaho, Arizona, Iowa, and a couple of other states got a hold of it. And they used, Arkansas used a bifurcated product that we had developed here in Mississippi. But the reason they could get their hands on those operating software plans was because the federal government paid for them, and we had to give them away. So the reason I'm telling you that is Kentucky's going to give us their software, which is worth about $40 million to us free. So that's a big deal.
So, yeah, that puts y'all sort of ahead of the game.
Well, it gives us about a 9-month advantage. So if we got a letter from Governor Reeves today, a letter of intent to establish an exchange, which is something we have to do, we could probably have an exchange up and running by September, October this year of 2024.
Well, now that's an interesting point. Governor, the legislation passed to give you authority to set up the exchange, but you talk about getting a letter from the governor. Governor Reeves let this bill come law without his signature. Have you talked to him about sending a letter to D.C. and is it still going to require a gubernatorial letter?
I had said I haven't talked to the governor at all about this, but and I have tried to call him. He's just been busy, and I got an email back that they would try to get with me this week and next week. This week's about over.
Yeah.
I don't know what he will do, but I went to a meeting last week in Atlanta, Georgia, to cover the subject. So here's the deal. You have to have legislative approval. We've got it. The former director of CMS, Randy Pate, says, and I've known Randy a long time, he said, Mike, look, you are an elected official statewide. The CMS would probably let you start a state-based exchange if they approved it without the governor's letter. And I said, well, you realize politically that's a nightmare. I'm not going to ask for it unless the governor gives us a letter. Our FFM is working let me just say this. Our FFM, operated by the federal government, works very well. So I truly believe if something's not broke, you don't try to fix it. The only advantage for us to do the state-based exchange goes back to where we were a few minutes ago, is the ability to offer more plans at a lower price because we can buy reinsurance that the feds can't buy today. Although they've told us they might give us a waiver to let us buy reinsurance, it's tricky to buy it for private industries without having some control over where the money goes. And we probably could operate the exchange, but I don't think it's wise to do it without having the governor on board, or at least having some of his approval to operate the exchange. So it's his call. Just lay it out there like it is. It's the governor's call as to whether or not we'll have a state-based exchange. We've done all the other hoops that we have to jump through, and if he says, no, I'm not going to give you a letter, it's a moot question unless you want to pursue it. And I've got a lot of other things I need to worry about besides that. I've got hurricanes, and it looks like we're going to have a horrible hurricane season, so.
Speaking of reinsurance,
and we approved that for the wind pool. The wind pool's had some management changes in the midst of hurricane, and the person they've got temporarily running the wind pool now has to have a hip operation. And if we have a hurricane during this summer, it's going to be a nightmare for us. So we're gearing up. We've already I've met with 4 other commissioners, including Louisiana, Alabama, and the Carolinas, and just said, look, we're going to need your help. Arkansas, Alan McClain has said, whatever you need, we'll be there to help you. And that's how we'll have to handle it. So back to the health exchange side, though, we'll wait and see what the governor wants to do. We're preparing to go either way, and it'll be his call, and he's got to make that decision. You hope they wouldn't make it politically, and I will say this, that Governor Kemp from Georgia is going to be the new head of the Republican Governors Association, and Governor Kemp's the one that wanted to have a state-based exchange in Georgia. Kay Ivey, the governor in Alabama, wanted to pass legislation this session in Alabama to have a state-based exchange, and she had some other things going on, and she finally called Commissioner Fowler and said, Mark, I think we need to wait to 2025 simply because of all the other things we have going on within Alabama. They had some other issues they had to address. So Alabama's going to be on board. Arkansas already has a form of an exchange. Tennessee, I don't think will do anything. The governor's still trying to figure out where he wants to be. They've got some unusual laws in Tennessee, and we copied one of those laws for the Farm Bureau folks to operate a healthcare system for their folks, which we don't have to regulate. We make sure they're solvent, but that's as far as we go. That's kind of complicated, but the bottom line is what we're trying to do is to have affordable health insurance for the citizens of this state.
And just to recap, the advantages of the state exchange would be perhaps lower premiums, if perhaps more insurance companies involved. And you said, I didn't quite understand. So would the state would be able to keep more of the insurance premium tax? Is that easy way to simple way?
That's a simple way to say it, because that all plays in the Medicaid expansion plan. We get 3% tax off the premiums.
Off all insurance premiums?
All insurance premiums. And you can get a 1.5% what we call clawback if you invest in the state. That's a complicated issue that deals with Blue Cross, basically. But dealing with the people that are on the exchange, the Centenes, the Molinas, the Vantages, and those folks, United Healthcare is on there, you get 3% of the premium base. And the premium on the new premium is $1.2 billion just on the expansion alone at 3%. That's $36 million in new premium at a minimum we know we'll get this year. That's in premium tax. If we had expanded Medicaid under the House plan, we would have gotten none of that money. CMS said, well, we think we could fix it to where you could get the premium tax. But what happens is the companies would have to pay the 3% in addition to the 3.5%, and in addition to the other requirements that the feds require, and you had a 9% to 9.5% tax on the companies. That won't work, and the state loses the money. And when you do the math on it, it's just a simple deal. When you do the math, the Medicaid expansion plan in the House it wasn't feasible in our opinion. Even if you had a 90-10 match and what they call a 5% bump, it still wouldn't work. The numbers are huge. We're talking about $700-800 million up to $1 billion in some cases. And when we ran all the numbers, and we had other folks run them, the mayor, Pat Christian, a former vice president of J.P. Morgan worldwide, ran the numbers, and he's the one that called me and said, Commissioner, we don't think this will work for the MML. And when you looked at it, we looked at all the scenarios, and the best thing to do on Medicaid expansion, just simply expand it to 100%. You're going to add about 25,000 people. That's all you add. And it costs the state about $50 million to do that. You're going to get $36 million in new premium. So you only have to pick up about $15 million a year to expand Medicaid to 100% of the property level.
Well,
and not have to have all of the shenanigans, administrative nightmares, and all the other problems you're going to have with the federal government. And then the governor may not sign the bill even if you expanded it.
Well, I didn't intend it to be a debate about Medicaid expansion, but real quickly, why does it work in 40 other states and it won't work in Mississippi?
Well, you call those commissioners and ask them to run those things, and they'll tell you, man, all that glitters is not gold. The grass is not greener on the other side. Be careful what you ask for. Be careful what you ask for. And when you talk to those commissioners, they say it's a nightmare doing the administrative portion of it.
Well, I want to get back to the exchange, but I'll just say that not one of those states have repealed Medicaid expansion after they adopted it.
It's pretty hard to close the gate when the horse is out of the pasture or the cows have left the pasture. You know that.
But anyway, going back to the exchange, let me ask you real quick. If we go to a state exchange, an important thing for people on the exchange, the federal subsidies they're getting now, they'll still get. So their insurance may go down, but it won't go up.
It may go down. Bobby, what we can do, and I did talk to the former head of CMS and a couple of other federal officials and asked that could we not apply for the cost share reductions, what we call a CSR, to eliminate the out-of-pocket expense. That's about $5,000 a year for all of those people between 0 and 100% and 38% of the property level, and also eliminate the premium. And they said we possibly could, but they want to have an expansion. I said that's not a requirement in the law. So I want to know
You're
why
talking about the feds picking that up.
Feds picking it up because that's their goal. And when you really look at why is that their goal, they're worried about the IRS fines that come in between, if you get below 100% of the property level, you can't be on the exchange. So the IRS will say you got to have a plowback for the dollars that we've given you. So you might have to expand to get away from that. You might have to expand Medicaid to 101% of the property level, and that just it fixes the breach in there. But 100% is the same thing. And we've talked about it, and I said if we did have a state-based exchange, and we asked for the cost share reduction at least 50% and zero premium base, which that's your goal, would you give it to us? And they said, well, it'd take a year or so to do it. And I said, suppose I sued you. The word was, oh, you wouldn't do that, would you? And I said, trust me, I would. I did it on the flood insurance, and I think I could get venue. I don't think anybody else could, but we could. And it would be a consideration because you're talking about a huge sum of money. And if they're giving it to New York State and California, New Jersey, and all the other states, we ought to get it too. And there are people that argue different from it, but I look at it as a fair share of what's due.
Well, I guess they're arguing you'd get your fair share if you get with the program.
Yeah, it's not going back to the federal government because if we don't get it, some other state's going to get it.
Right.
And what's interesting, I think there's some, I won't mention, there's a huge, large state in the south, east, maybe the southwestern part of the country, that is looking seriously at doing what I'm talking about.
One thing I wanted to ask you on the exchange, the state exchange, that bill when it first got introduced was a little bit different. It had
Tax credits.
It had a bunch of tax credits in it that I know the Senate looked at with some skepticism and took them out. What were those? They were gone by the time I started looking into the bill, I think.
Well, the tax credits go to the companies, and I suggest, and let me say this, Representative Trey Lamar and Senator Josh Harkins are two of the best guys I've worked with. These guys, they're easy, they're to the point, there's no BS about them. Trey's got a good background because of his mother in law, and Josh does because of his dad being involved in business. So, and
they're chairs of their respective, the Finance Committee in the Senate and the Ways and Means Committee in the House. But anyway, I'm sorry, go ahead.
And they're easy to work with. When they ask you a question, you can answer it. And when we ask them questions, they give us answers. They don't hee-haw around. It's business. We do what we're elected to do at that point. So we don't need tax credits. We don't need to be giving companies incentive to be on the exchange. I just think they're crazy to give them a tax credit. The game plan should be, it's what my old economics professor at Mississippi State used to say, is to pick all the feathers off the goose that you can, but still enable him to fly and eat grass.
Okay.
Well, on that note, I'm going to end with just the bottom line is if the governor signs the letter and we do go to the state-based exchange, the people on the exchange will not be there will not be negative impacts for them. The people, the 250,000 people roughly on the exchange.
No, not that we see, and not that from what we've been told with CMS. And just as a matter of fact, we had a long meeting with 6 of the top officials at CMS and with the official that runs the Federal Exchange Program in D.C., a person that we've known for over 12 years. And he was on our side about what we were trying to do. And we want to be certain that we're on the right step. This is not something you shoot from the hip from. You've got to really have your facts in order. And we think that it would benefit the whole state. You've got a lot of things you can do to help folks. And all of this is going to tie together down the road with where we are on Medicare Advantage plans and Medicare Part D programs. That's a big deal. And the feds want to move to Advantage plans, and you say, what does that have to do with the exchanges? Well, if you're over 65, you got to have that as a requirement of law, your Part B, in one shape, form, or fashion. And the Advantage plans flip-flop a lot of consumers. Now, the one advantage we have with a state-based exchange, we will not have out-of-state brokers flipping people in and out of different programs. They get access to the databases, We have people that have been flipped 10 times, and you say, well, what does that mean? They'll sign you up in Centene, move you from Centene's plan from a bronze to a silver. Centene won't know about it. Then they'll move you over to Vantage, and then they'll move you somewhere else. And what happens is they make a commission right then and there, and the consumer doesn't know what's going on. They've got their name, and they may have them recorded as saying, yes, I want to do this, or yeah, it's a cheaper plan. And the companies are the ones that get messed over. I would put all these people under the jail if I could get away with it. That's where they belong, and I think we could stop a lot of that.
Okay, and you can do all those things, but you still have the regulations, the federal, in terms of the minimum that the insurance plans have to offer under the federal guidelines. They'll still have to do that too.
Yes, they would, and it would be a win-win for everybody. Now, let me just say this: that the ACA plans pay about 30 to 35% more than what you would be paid for the same procedure under Medicaid.
Well, that's not what the hospitals say, but
well, the hospital, get them to explain it to you.
Yeah.
How can you say that adding 25,000 people to Medicaid rolls will bail out the hospitals? That's not going to bail out anything. Yeah. The only way you're going to fix a hospital deal is to have a thorough study in this state as to how do you deliver health care within the Delta and within the rural areas of the state, and what kind of plan do we need 1 year, 5 years, 10 years, and 20 years down the road to deliver health care to these areas. If you don't deliver health care, you'll have no population that will live there.
Commissioner?
That's another podcast if you want to talk about it.
Yeah. Well, I think we can have three or four.
Three
or four more here shortly.
I appreciate you coming on and explaining this, in some ways, complicated but issue. But at the same time, the issue for the people who own the plans, their insurance will continue under either scenario. So that's the important thing to remember.
You want continuity. You want a healthy population. That's our game plan, at an affordable price. And when somebody's sick, they have availability, affordability, and accountability. That's the other third A that people don't talk about, that you get quality health care. It's just not something off the wall.
Thank you, sir.
Always a pleasure. Geoff and Bobby, thank you.
Thank you.
As we cover the biggest political stories in the state, you don't want to miss an episode of The Other Side. We'll bring you more reporting from every corner of the state, sharing the voices of Mississippians and how they are impacted by the news. So what do we need from you, the listener? We need your feedback and support. If you listen to the podcast on a player like iTunes or Stitcher, please subscribe to the show and leave us a review. We also have an email in which you can share your feedback. That address is podcast@MississippiToday.org. Y'all can also reach out to me or any of my colleagues through social media or email. And as always, thank you for your feedback and support. Subscribe to our weekly podcast on your favorite podcast app or stream episodes online at MississippiToday.org/theotherside. For the Mississippi Today team, I'm Adam Ganeshow. The Other Side is produced by Mississippi Today and engineered by Blue Sky Studios. We hope you'll join us for our next episode.